Hey, hi, it's Kit. Alright, so I am 1 month post-op top surgery with Dr. Sassani in Fort Lauderdale, Florida. And this is just going to be show you what it is, tell you a little bit about some of the problems I ran into in case anybody else has top surgery, like what the hell is happening, because I did that and I freaked out. And then also like just general after surgery care. So let's start with what it looked like. So we'll start with top surgery results. Wow. So this is my chest. Again, I am like 4 weeks out. Scar's really clean. I'll tape them back up right after I do this video. Nip's looking good. I'll tell you a little bit about that too. No dog ears or anything. Pretty clean lines. Feel good about it. Really flat. Let's see if we can do that for you. Really flat. It's awesome. And then my drain tags are up here. So I am really happy. I'm really happy with this result. Like, it is so freaking fantastic. So that's what it looked like. As far as like what happened after the surgery and then things that were freaking me out, I mean, I've talked about pain and all that stuff before in my last 2-week video, but specifically with my nip nops, I experienced some. I mean, discoloration is normal. I think you see that on other trans guys, and you're like, oh yeah. I mean, I'm kind of expecting them to be a little more like this one, where they're, you know, like some weird miscoloring things happening, and it's trying to figure its way out, and so it gets, you know, it scars, so it can be like black to start, blackish, not like black, but like dark, you know, scabby, and then pink and light pink and different colors of pink show up, and so I think we kind of expect that. The one I wasn't really expecting was when actually the same nip, the center part, the actual nip itself, not the areola, was like a little more like what this one's doing now almost, where it was like mushy and soupy. This one has been here for a while. It's been here for a month, so it's scabbing short and it's gonna get soft and it'll probably fall off. But this one, from like week 2 on, that nip was just like, I mean, it was like soup, and it was yellow and really, really soft. So I was freaking out I was gonna lose it, and so I called the doctor, did the thing, like, hey, what do I do? They said it was fine, but then by like 3 days later, I was pulling off the gauze, and it was like coming off with it, which was not cool. So I called him. He told me it's fine. Just use a toothpick and try and, you know, scrape off that flesh and keep it on the nip as long as possible. And the skin is you know, to me it looked like a crater. I was like, dang, I don't know, a crater nip. That wouldn't be the worst thing in the world, but it's growing under there, so it's doing exactly what it ended up doing, which is filling in. And it's still, right now, it's flat. It's completely, it's not cratered in, but it's not really out either. Whereas this one is like out, like a normal nip of sorts, or I guess a more average nip. But this will probably do the same thing, where this part will fall off, or you know, and then more skin will come up. So that was my big freak out. Was just like, what do I do? And it's nothing to freak out about. I mean, if your surgeon's great like mine was, he was just like, listen, worst case scenario, it doesn't come back in. I can take some sample of tissue from somewhere else and do a minor readjustment. It'd be an in and out, really quick thing just to try and, you know, fill it in. So Sassani is awesome. He's very calming, like very like, you're fine. Like, we'll have to see what happens, but it's fine. You're not losing anything. And so far, again, the results have been amazing. So I couldn't be happier about that. Real quick, like just what I did post care was, and what he recommended was, I've got my kind of routine down, which was a little bit of polysporin, like a thin layer, just enough to cover on top, and I have these occlusive gauze strips. That's what they look like. He gave me a full pack. I went on Amazon and bought more because I didn't want to spend the time to cut them into just the ones. I was just like, I'm not doing this real pretty, and I want to be able to use this for a month. So this stuff, I got a couple more. I've actually been through probably 2 packs. It comes in a pack. Let's see if I can just show you. I can't just show you. I'm going to use my elbow. I'm that creative. So it comes in a stuff. It looks like this. I recommend going through and just making strips, like making those little squares, cut them out, put them right over your nip, and just having that ready, because it's really annoying to have to cut it every single night. So you cut them into little squares, put a little polysporin down, put that down, put a little piece of gauze, and then tape that over it. And the gauze that I liked is the blue. Well, gauze is normal, but the tape over it is the blue non-stick stuff. I just ran out. because I've been on this for months, so I don't have any to show you, but it's blue, real light. That clear stuff and the like stuff that looks like white, not good. It just stuck to your skin and like sucks. And then afterwards, now since my stitches have come out, I've started to proactively work on scar care. So I have heard two things, and I'm kind of mixing the two and seeing what happens. So one is this Invincible Scar silicone gel. We'll see what happens there. So I also do that kind of just to lube them up so I can massage it, because everything has said silicone, vitamin E. There's a lot of like mixed results. If you Google it, people are like, this is the best thing ever. And I'll be like, and it didn't work for me. So I think that's, you're gonna have to figure out what works for you, but pretty much proven across the board is massaging is good. So I do that. I use the actual gel cream stuff to just get it where I can just run my finger back and forth. So literally just back and forth and back and forth, and working specifically towards the ends because that gets the least amount of movement. It's definitely harder now that things don't hurt not to move as much. So I'm still trying to be good about not range of motion. And the other one is this Medipack tape. It comes in a cooler package, I'm sure, but I just got some from Amazon. It's the silicone gel. It's been more frustrating, I'm not gonna lie, just because it doesn't stick super well. So, I mean, it sticks, but then it I can't just use one strip and go over because then it bunches. So I'm gonna go through it and then probably try something else, just because it's been really annoying to try and actually keep on my skin. So I'll let you know what that is. If you have any questions about, again, more stuff about nip stuff, or you've been through surgery and you're freaking out, I'm not a doctor. I can't tell you what the hell is going on, but if it's anything similar, I can definitely be like, hey, this is what happened to me. So, hope that helps. 1 month post-op. Wow. Nip knobs are free. Thanks for watching.